So we're going to assess if there are any infected lips, gums, oral mucosa, and tongue for descriptions, assess for any physical activity limitations, and assess the oral hygiene preference, which are the frequency, time of day, and the type of hygiene products for the patient. So the possible nursing diagnoses are risk for aspiration and impaired oral mucous membrane. So for the preparatory phase, the first procedure is to assess the client's ability to brush the teeth and rinse the mouth. This is to determine if the patient is capable of self-care and knows the type of care the nurse is going to do. Procedure number 2 is to explain the procedure to the client and inquire about his preferences regarding hygiene care. So, sir, my name is Sunri Arona. I am a student nurse. As per doctor's order, I am going to brush your teeth in order to perform oral hygiene. Okay, sir. So, procedure number 3 is to wash hands. Procedure number 4 is to gather equipment and place over bed table. Organization, facilities, performance of tasks. Procedure number 5 is to pull curtain or close room door. This is to provide privacy for the patient. And procedure number 6 is to raise bed to a comfortable working position. Raise head of bed to a position in which client move to a position near you. Proper bed height helps reduce bed strain while performing procedure. And procedure number 7 is to lower side rail and place towel on client. This is to prevent aspiration of fluids into the lungs, the bowel, and protect the patient. Procedure number 8 in the preparatory phase is to reach and adjust height as needed. This facilitates free administration and saves time. And lastly, for the preparatory phase, apply toothpaste to toothbrush and hold toothbrush over excess basin. So brush inner and outer surface of upper and lower teeth, always brushing from gum to front of each tooth. Sir, thank you so much, sir. Brush one tooth at a time. Clean whitings of surface of teeth, also by moving bristle back and forth. Then, hold brush at a 45-degree angle and slightly brush over the surface of sides of tongue. Avoid initiating gag reflexes. Then allow client to rinse his mouth thoroughly by taking several sips of water, swishing it across all tooth surfaces and spitting it into the emesis basin. So sir, pakibukmong ko sir. Hindi lang yung sir. Very good. Then next procedure, allow client to gargle and rinse his mouth with mouthwash. So sir, paki-gargle ko ng mouthwash, sir. Then assist client to a comfortable position, remove bedside table, raise the side rail, and lower the bed in its original position. Then wipe off the overbed table, discard soiled linen and towels in appropriate container, and return equipment to the proper place. Then wash your hands, and then record and and report procedure in nurse's notes mentioning specifically conditions or oral cavity. So for the unconscious patient, the first procedure that we are going to do is to explain the procedure to them. Even though that they are unconscious, we must pretend that they can hear us. Then we must wash our hands. Then the next procedure is to place towels on overbed table and arrange equipment. This facilitates error-free administration of the procedure and saves time. Then the next step is to provide privacy by pulling the curtain around the bed or close the doors. Then we're going to raise bed to its horizontal level and lower the side rail. Then position the client on side near you. Make sure that his head is turned towards the mattress. Then we are going to place the towel under the client's face and emesis basin under his chin. Carefully separate the client's upper and lower teeth using the padded tongue blade. Then what we are going to do is to clean the client's mouth using toothlets or tongue blade moistened with mouthwash or water. Suction as needed cleansing, clean chewing and inner surfaces first, swab roof of mouth and inside cheek and lips. Swab mouth, rinse, repeat as needed. After that, apply petroleum jelly to the client's lips. This will act as our lip balm. Then explain to the client that you have completed the procedure. So sir, nauman nato sa tunguan, pag-brush mong teeth. So ako nang ibalik sa original, kasi mo original na position. Reposition the client comfortably, raise side rails, and return bed to its original position. Clean the equipment and return it to the proper place. Dispense soiled linen in dirty utility room. Wash your hands and record the procedure in the nurse's notes. Don't forget to mention pertinent observations. This is for the frequency of the procedure and to improve intervention. Okay sir, so sa toong pag-floss, imong paon gamit imong third finger or middle finger sa tanatong kamot. O lagi na ito iikot sa tong middle finger, both hands. So ang pag-floss,
Tuyok mo sa amin sa finger yun.
Ano?
Oh. Dapat marapid tayo. Ragahi.
Alam ko. Ano ko na? Sige. 1, 2, 3, 4. Okay sir, so top of floss, you're going to wrap the floss on the third finger of each hand. So ang middle finger. So mo siyang ipatuyok una. Then ipakwaon. Dili mo na ipatuyok sa mong middle finger yapon sa pikas kamot. So ang pag-flosser, kay mo siya ibutan mo siya sa tunga sa imong duha ka ngipon. Kaya mo motion na sir kay back and forth. So, ipasakita na gani imong gums sir, or pati yung nagkasakit sa imong gums, tanggalan na yun sir, kay ipalaw sa atong gums. Then, sa imong nagamit ay ang part sa floss, which is, for example, gani, mo na yung ipatuyok sir, taman din for hygienic purposes. So, yun, ano ang pa-floss sir.
Thank you.